Hello, everyone, and welcome. Welcome to Healthcare Excellence Canada's webinar. This is our final series of our Enabling Aging in Place webinar series. I'm Andrea Piché. My pronouns are she and her, and I'm really pleased to be your host today. As you come on in the room, I invite you to say hello. You can do that in the chat. Please share the name of the ancestral lands that you're joining from and let us know where you are. As I mentioned, this is our final webinar in our series, and we are so pleased to be concluding this series by hosting a panel discussion on what it means and what's needed to age well in Canada. We're pleased to offer French simultaneous interpretation by Boost Events, a subsidiary of Boost Lingo, for this session. If you wish to hear the voice of the interpreter, please select French from the interpretation menu at the bottom of your screen. And if you don't see that, what you might see is a little more button or ellipsis with three dots in the middle, and that's where you'll be able to select interpretation from. If you need support at any time during this webinar, you can just reach out to our tech support using the direct chat feature. We also invite you to participate in the chat at any point using the chat box in both English or French. And just noting that this session is being recorded and we will share a link to the recording in the next coming weeks. To start, I would like to acknowledge that we are meeting on land that has been inhabited by Indigenous peoples since the beginning. In particular, I'd like to acknowledge that I have the privilege of joining you from Grimsby, Ontario, which is the traditional territory of the Anishinaabe, Haudenosaunee, and Ojibwe and Chippewa people covered by the Upper Canada Treaties. And as I continue my personal journey of truth and reconciliation, I actively seek out wisdom inherent in First Nations, Inuit, and Métis traditions, and I'm particularly drawn to the teachings that align with the seasons or the time of the year, just something that really speaks to me. And something that I was recently reminded of through Indigenous traditions that have to do with this time of the year is the focus on gathering and gratitude. So I hope that you'll join me in appreciating our opportunity to be together as a community and to have the conversation we're about to have in the spirit of honoring our elders and the gifts that they share. If you haven't had a chance already, I'd like to invite you to introduce yourself in the chat. Let us know the lands that you're joining from today. And thank you to my colleagues who, in the background, will be adding the native land website in the chat. So if you want to learn more about the territory you're joining from, you can click on that link. Also, since I know folks can't always stay till the end, if you learn something that's really valuable to you today or something that's, just what you needed to hear, to me, I think there's no better offer of gratitude to our speakers than to pop your key takeaways or insights into the chat before you go. And we'll be sure to save that chat for our speakers so that they can see the impact this conversation has had today. And now it is my pleasure to welcome our four panel members for today. We have Bella Petawabano, who's from the Cree Board of Health and Social Services in James Bay. We have Dr. Suzanne Dupuis-Blanchard from the Université de Moncton. We have Zannat Reza, who's with HelpAge Canada, and Dr. Samir Sinha from the National Institute on Aging at the Toronto Metropolitan University. So welcome, all of you. Thanks for being here. Just bear with me. I'm trying to get a window moved so I can see everybody well. Ah, there we go. And I'll just take a second. Bella, if you're able to put your camera on, would love to be able to see you as well. Ah, wonderful. Everybody's here. Great. So maybe to get us started, I know that each of you has a really rich set of experiences related to aging in place, a nice diverse set of experiences. And so I thought maybe we could start by each of you introducing yourselves, and then sharing a little bit about your connection to aging in place. And if it's okay, I'd love to start with you, Bella, and then I'll go to Suzanne and then Zannat and Samir.
No matter what age you are, um, you're always like saying this little prayer, please let me not be the first.
Should have warned you. I'm sorry. You've
That's
answered my
okay.
prayer.
That's okay. Yeah, so I would like to say a few words about who I am. I'm Cree. wajek mswe mi den se wapm de goods naskum noga bijwi shamyek. So I am I'm 73 years old, and so people always ask me, are you enjoying your retirement? I still don't know what retirement is because I have not been able to retire, even though I stopped working and then I started taking contracts, and it's like it hasn't stopped. And that makes me feel good because it makes me feel young and it makes me feel like I can still contribute. So while I can do that, I want to do it as long as I can. So, to make it short, I've been working in the health and social services of James Bay almost all of my entire career. I started as a frontline worker in health and social services and worked with my way up. I've been a manager, I've been executive director, I have um, uh, become the chair of the Cree Board of Health and Social Services for 8 years. And I also worked in public health. I know some of you mentioned public health or community health. I've done that that kind of work also, and and did some contracting work. But my most rewarding experience is not really related to the work, paid work. Let's say, it's the work that I did outside of my work, and that is I've never really worked in the front line in terms of working with elders or people who have special needs. I have not really done that, but I've done it in terms in my own community with my own friends and who were like older than me. Some have passed on, and like I'm the younger in my circle of friends, so I've done a lot of work in terms of helping them out. One passed away 3 years ago, dementia. She was one of my best friends, and I helped her out as she started to the first stages of her dementia up until she went into care. And I also had a friend who died of cancer 3 years ago, and I that's when I got involved into doing palliative care. This is after I have retired, and so now I'm still continuing that, helping people in my community with that. And one of the things that I really like to do is to advocate for these people because I know what's out there, but they don't. They don't know how to access the services. They don't even know what exists out there, what they're entitled to. And this is one of the ways that I help them. I can't wash floors for them, but I can do that. And this is what I do. So I've been in the health sector for all these years. I'm a mother of three daughters, six grandchildren, one great grandchild. And my husband recently passed away after having had a stroke 18 years ago. And I also helped my aging parents from a distance, helped my late husband from a distance as well. So this topic is very close to my heart, not because I am aging myself. Thank you.
Bella, lots of love coming in. I see hearts on the screen, and there's beautiful messages um, with gratitude for you being here. And just like to say that, while you describe yourself as, not having been a frontline care provider, I would argue that in a lot of sense, you are a frontline care provider to your community. And so thank you for bringing all of your wisdom and experience to this conversation. Um,
Thank you.
then now, Suzanne, can I ask you to do an invitation and share about your connection to aging in place?
Yes, certainly. And thank you so much, Bella, for sharing your experience. My experience is a bit different. It's more professional. And so my connection to aging in place actually started when I was a young nurse and was working in community health with older adults and saw this was in the early 1990s. And aging in place was not necessarily discussed as we are today. It was just, well, you're at home, and if you have to move, well, everybody has to move, and it wasn't necessarily thought of maybe a difficult transition, or and the services in the community weren't the same, and so just around that. And I saw the struggles that older adults were having that I was visiting at home. And it always interested me that we hadn't, as the health system, really thought of this population and the challenges that they were facing in that, staying at home and relocating or not, and all of this, and brought that to the rest of my career, actually. So the practice experience that I had on the ground has informed the research that I do as a nurse researcher at the University of Moncton. And I've done probably around 20 years of research on different facets of aging in place. And that has brought us, my team and I, to develop an aging in place approach that we call nursing home without walls. So, I've seen my grandparents as well who have aged at home and have been, they had been able to stay at home well into their 90s. My parents now that are still doing very well in their 80s, but living at home and sometimes needing help and things like that. So I think it's a topic that we can all relate to. Yeah. So thank you for that.
Thank you, Suzanne. Nice to have you. And folks are really just agreeing and feeling aligned with that notion that around choice of where we can age in place, and how things have changed to a certain extent, but in a lot of ways they're still experiencing the same reality in terms of what happens as we age. So that will, I think, lead to good discussion as we go forward. Zannat.
Yeah, thanks so much. Such a pleasure to be here. So I'm Zannat Reza. I'm currently the Chief Impact Officer at HelpAge Canada. My background is in community health, and I've spent over 25 years in the health promotion space, specifically around knowledge translation, storytelling. And more recently, my work in the aging space has been around collective impact and thought leadership. And I love to find creative ways to drive change. For those of you who don't know HelpAge, we're a Canadian registered charity and international NGO, and we work and partner with communities to help the well-being of older adults. We're actually celebrating our 50th anniversary this year. So I'm at HelpAge. Previously, I was the director of the Future of Aging team at SE Health, where I had a lot of fun amongst all my projects to produce and host the Future Age podcast. In terms of my experience with aging, well, I'm literally aging as we speak. And Bella, I loved how you shared your age. And I do think sharing your age and owning your age is an important part of healthy aging. So fully transparent, I'm 53. I'm part of that sandwich generation where I've got kids, but also aging parents and aging in-laws. And I look at my neighbors on this street who've been on our street for over 30 years. They're in their 70s and 80s, and this is where they want to be. In fact, one of my neighbors said, "You're going to have to carry me out in a box." So when I hear these real stories, I feel good about the work that I'm doing.
Thanks, Anna. Thanks for helping us celebrate who we are and the age that we are and all that it brings. And for the nod to the community-based service sector and the importance that that doing things with and through the community and not just our institutions has a significant impact. Samir, over to you. We'd love to hear about you and your connection to aging in place.
No, thank you. So Samir Sinha here, and I'm a geriatrician and clinician scientist at the Downtown University of Toronto Hospitals, and but also I've been an avid kind of practitioner and researcher in the space because I primarily and almost exclusively work with older adults, doing everything from home visits to seeing people who've been admitted to hospital to taking care of patients in my outpatient clinic. And every day, I see older people and their families who are struggling, especially when a healthcare issue arises, such as dementia or other things, and almost that deer in the headlights look. I think Bella was talking about how it's not just the older people themselves, but often their family members and friends who don't even know where to start. They don't have the right diagnosis, they don't have the right information, they don't know what they're eligible for or how to navigate the system. And so it's often pained me to realize how hard we make it for people to actually do what they want to do, which is age in their own homes and or in their own communities for as long as possible. So I've been really privileged throughout my career now to take on opportunities and leadership and helping develop government strategies, and certainly now doing a lot of research through my role at with the National Institute on Aging at Toronto Metropolitan University, where we really focus on this idea of aging in place or even aging in the right place. And so I like that because, yesterday I was doing a home visit to help make a diagnosis of dementia, and there I was with the patient and their son and the niece from New Brunswick, and literally Suzanne, and it was one of those just classic examples where it's like, so where do we go? What's this going to look like? Or in my clinic yesterday, where one of my longstanding patients, she now has really descended into dementia, and now but she wants to stay at home. And that's all she wants to do. So now her daughter is going to move in with her, and they want to know, what is this journey going to look like? And I said, this is going to be hard, but we're going to do it together. And so it just reminds me about how important it is for us to do this from so many different angles, and how much work there is to be done. So I'll stop there, but really thrilled to be here and to celebrate with everyone who's been working in this area too.
Thanks, Samir. I'm going to let you pause there, but not stop there, because I think the story that you just shared, I think just connected everybody on this call. I think that's something that most of us have experienced with somebody that we know or care about. And so I feel like that's a beautiful segue into where I wanted to start the conversation together, which is around, what does aging with dignity mean in our Canadian context? You're somebody who's helping folks navigate that and to try and maintain as much dignity as possible in the ways that they want to age and remain at home. So from your perspective, what does it mean to age with dignity?
Well, I think we have to also be, and I think, Suzanne and others, I know we've talked about this, but we have to just be really mindful of the language we use and the terms, because I think sometimes, they talk about successful aging, right? About, getting to 100 and doing, jumping jacks and running marathons, and that the idea that those people are successful and everyone else is unsuccessful. And even this notion that aging in place means that, you end up aging in your own home for as long as possible. Sometimes that is the best place and where people want to be. But sometimes, other environments, and that's why we talk about this idea of aging in the right place. What's right for you? But the one question we often ground ourselves as geriatricians is, what matters most to you? And I think that kind of really gets at that idea of aging with dignity, is understanding what that person wants and not putting this projection that being at home is always the right way, or doing this in that way. You start realizing, whenever I have the privilege of walking into someone's home, how there's different family dynamics, there's different circumstances, and so I always kind of position around, what matters most to my patient and what matters most to preserving what's important to them, and how do we figure that out together by knitting together those community-based resources and those other supports that we can do. So that's when I think about kind of aging with dignity. I often think about, preserving or supporting dignity is by honoring what matters most and trying to achieve that for an older person and their family.
Mm.
Thanks. Come on in, Suzanne.
Yeah, I would add to that. I completely agree with what you just said there, Samir. I would even add that it's also respecting their independence. That even though they have whatever condition or whatever is happening to them health-wise, that we still remember that these are they're individual, they're people. And it's not the age, but it's definitely recognizing that they remain independent in decision making as well, to the best of their capacity, right? And to keep respecting that, I think it goes a long way as well.
Yeah,
Yeah,
I
and I
would
like aging in the right place too. Sorry.
Yeah, and I was just going to say, I completely agree with both of you. I mean, ultimately, it boils down to everyone gets to age on their own terms, whatever that might be. So, having control, choice, feeling respected, and really staying connected to the people and places that matter. So, to your point, Samira, yeah, aging in the right place, whatever that might be for each person. And also just picking up one of the points that you mentioned about community supports, because when we look at community organizations that provide programs and services for older adults, these organizations really are the lifeblood of our communities because they're providing a lot of services that speak to and address the social determinants or social drivers of health. And so I would say aging with dignity is having access to those the supports that help people live where they want to live.
Bella, you've had the honor of walking alongside people who were able to age in the place that they wanted to, and maybe not always at times. Just wondering for you, what does aging with dignity mean?
Yes, it's very interesting to listen to what other people have to say about aging. Um, I suppose I could say with my generation, because I come from I have a background and come from a family who were hunters and trappers and who lived on the land, and where they were very independent and autonomous, and grew old within, which was the only place. I am assuming it was the right place for them to be, and they were surrounded by family. They didn't need much community support because everyone in the home was there to provide the support that they needed. And most of all, they had their grandchildren around them. And in most cases, those people who were aging in a family unit like that, they were the ones who were doing a lot of the educating and looking after the little children and spending time with those little children. That was their contribution in addition to being advisors to other people within their own environment. They had a big role to play. So when it came to my parents who were aging, they were no longer living in their teepees, in their winter lodges. They were living in the community, which is very different because now you're living in a house. Even though they had running water, electricity, everything that they needed, they experienced something very different from what the past had for their parents, and that is isolation. They have the walls, they have the family have grown up. Like I said, I provided support to them from a distance, which meant that I was not there. So, but I was able to get them the kind of services that they would need, and stay connected to the people who were providing the services to make sure that they got what they really needed to be able to stay in their home. And each of them, my father and my mother, both died at home, and that was what they had wished for. They said, if there's nothing else that anybody can do to keep us alive longer, then why not just stay here and we'll die in our home. So we respected their wish on that, and that is exactly what we did. So that has changed now. And so for me, because I had seen my parents live in their own home right to the end. Although they experience a lot of isolation, they depended on outside support, outside help, all the services that the health social service sector can provide, not all there, but the basics, because we don't have everything. And so they were able to remain at home. So that's now I'm getting to that period where now my turn is going to come. And I can see the isolation. Right now, I used to say that to my children. It's really, really important to hang on to your friends. Be kind to them. Help them when you can, because someday you may need that help from them. And that is what happened just recently. I had mobility issues, and I'm so happy for the friends that I have, because they have inspired me to do all I can to get back on my feet and be who I was, maybe not 100% before I had that mobility issue. So it's but it's their inspiration. It's really these people, even though they hesitate, they don't know how they're going to help you, but they come. And what I like the most about my friends is that they'll come and he said, okay, I'm here for an hour or 2 hours with you. What would you like that I do for you? So then I would tell them, and you could tell that they were very happy that they were able to help me. And of course, I mean, it's, and but in my mind, I'm always thinking that this is only temporary. I'm going to get better. I'm going to be able to do these things myself again. But I know that a time will come when I will not be able to do that. But while I can, I want to be able to be as independent, as autonomous as I can, and take the care, take the help that people have to offer me. And like I try to spread my needs, I guess I could say my wants. I want some groceries delivered. So who do I ask? And and I know what some of them are still working. They're still they have commitments of family, etc. And I try to be realistic in what I can expect, and from them. So that's what aging with dignity is. And when it comes to for my friends, I was able to advocate for them. I know what's out there, and I know how to get it. So that's for me, that's okay. I can do that, but not all of them can. Not everybody. This is it's very different in Indigenous community, because we don't have access to services. Is something that is it's some are there, some are not there. Isolation is one big thing in the communities. And so and affordability. I can afford to go and get acupuncture. I can afford to go and get physiotherapy. I can go and get services from a chiropractor. I can afford to do those things. But most of my friends can't. They don't have the means to do it. And in some cases, they don't even know what those are. I can tell my friend, well, you should go for a massage. And you say, what's that? So, so it's it's like in the communities where there's minimal access and a lot of isolation, it's really hard to get something for those who are aging. So we have a long way to go to be aging with dignity.
Bella, I feel like you've sorry, Andrea,
No,
but I just have to jump in because there's two things that Bella has said that I think is so important to be able to age in place. And that's being able to ask for help. It's very difficult to ask for help. It's also, I've been told by many participants in our projects on aging in place that when you ask for help, it shows a bit of vulnerability and that you're losing some independence. But at the same time, if you do get that help, you gain that independence back, right? That's what a lot of people don't realize. So you talked about, who to ask and that you were asking, and I think that is so important. I just wanted to highlight that, and that you've surrounded yourself with friends, and those social relationships, right, are so important as we age, and to keep those relationships, to work at them, and to keep them alive and nourished. And you talked about that very nicely. And I just wanted to highlight that because I think as we think of the challenges around aging in place, I know for myself, when I think of some of the challenges, yes, there are the access to services and all of that, but there's also a personal role of being able to ask for that help. And so you spoke about that so well.
And just and if I
Thank you.
and if I can just hop onto that too, just because I think not only is it about the importance of being able to ask, it's also fighting that stigma of being seen as a burden. Because I find often in when I have families, I'll have the older person there who says, "I don't want to be a burden. I don't want to actually. I feel I'm being a burden." And sometimes it's almost kind of saying, "But none of us see you as a burden." And I always try and use the analogy that um, you looked after these kids or these friends, or you've been friends to them for years, and now they want to help you, right? Like I mean, now the roles are a bit reversed and so on. Your children are not here out of obligation; they're here out of love. And so it's okay. So let's get it out on the table what we need, because and by asking for that help, to that point, don't see yourself as a burden. You're actually helping your loved ones make sure that your needs are being met. So it's that careful balance between making sure that people can ask, but also dispelling that notion or that barrier to asking, about being worried about being seen as a burden to other people, and negating all the help that when children may have been a burden for the first number of years. We don't look at it as a burden. We look at it as love and doing that role. And so it's always a little bit of one of those things to check in on feelings and feelings that sometimes get in the way.
And I should add that one of the things that you touched upon, Bella, is the whole notion of people checking in on one another. So, neighbors checking in on neighbors, and it doesn't have to be super formally structured that it's the responsibility of organizations to do this. I think every one of us plays a role in doing that. And then to your point, Suzanne, about surrounding yourself with friends and like a strong support network, so you're socially connected. I would add to that bringing in an intergenerational lens. So mixing and mingling and connecting with people of different ages, I think strengthens communities on a number of different levels. So not only from a personal level, but it also challenges stereotypes about aging. And we know that ageism, age discrimination is a huge issue and obstacle for healthy aging. So I do think connecting and being part of initiatives, even on your street, of connecting with people of different ages is one of the ingredients for healthy aging.
Lots of threads to pull from your sharing, Bella. And Zannat, you sort of went into a direction that I was thinking the conversation might flow nicely into. And that's sort of been reinforced by everyone here. And it's that notion of balancing family and friends and more natural forms of support and caregiving with formal health and social services. And, Bella, you mentioned how you have the gift of being able to navigate both, that you know and understand the system so well. So for you, it's easy to see and understand, what to connect folks with. And I know, Suzanne, through your work in Nursing Home Without Walls, that's a primary focus of helping folks, learn and find and know what's out there, but while at the same time building and developing deeper connections with people in their community so that it's not all, in the form of formal health and social supports. So just wanting to open up the conversation to, how do we help people get the supports that they need? Going back to your question, Samir, of, identifying what matters to them and connecting people with what matters to them. I think this is the essence of the challenge, and that there are a lot of folks that are going into long-term care who maybe wouldn't prefer to be going there at that point in time, but they're not able to connect with what they need to meet their needs and what matters. And I know, Zannat, we've talked about that a lot as well in terms of some of the different living models to support older adults. So just throwing it up there into the space around this navigation balance of formal and community, and how can we move forward in terms of keeping people at home through navigating that?
Well, I would say the future of aging is really community and supporting community-based organizations that support older adults and others. And when we look at these community-based organizations, there's this term that we're affectionately saying the CBSS sector, which are community-based seniors serving organizations. There are over 10,000 of these community-based organizations across the country. But these organizations, as much as they are the lifeblood of our communities, are unrecognized and very often underfunded. So if we're talking about supports, and especially the non-medical support, so help with transportation, which often comes up as an obstacle to aging in the right place, so transportation, meals, mental health, physical health programming. Like these are the types of programs and services provided by CBSS organizations. And yet, where does the funding go? More hospitals, more institutions, because that's what is sexy. But I'm going to tell you right now, it is funding community organizations is the place to be. And we're talking about navigating services. Things are siloed and fragmented, and really we need to break that down. Some of the work that I did previously is around this notion of creating 360 ecosystems or living models. And for sure, the Nursing Home Without Walls is an excellent example of that. So this is where, we're truly wrapping around services for individuals. So health, housing, community supports. It's all in one place. It's like a one-stop shop. So all to say, we really need to put money where it's going to make an impact, and that really is the community.
Yeah, I agree completely. And if I can just jump in, it's definitely in the community, but I also think it's a mixed approach, right? You need the formal services sometimes. Sometimes it's mostly community. But it's all based in community. It's those relationship between the silos that has to be addressed, and that's what we're seeing with Nursing Home Without Walls. It's allowing that person-centered approach and that flexible approach based in the community, but at the same time, coordinating the services that are needed. So if it's from that non-for-profit organization that we can partner with and maybe help with certain fees that they have because they'll be coming in to provide services, or if it's with the provincial government, or if it's with the long-term care facility that we've partnered with for Nursing Home Without Walls, it's having that someone that can coordinate that and have the person with their needs. The focus is on that, and then the rest kind of comes in. But I agree, it's based in the community, and basing it in the community shouldn't reduce any other of the services. It should just change the lens by which we do the approach, and we look at the assets that are there, and what we can rely on and what needs to be developed. And I think that shows that it's working. I see in the chat as well a lot of questions around the housing of older adults. And there are different models that maybe we haven't yet really looked at, like co-housing, for example. I know we're doing a bit of work looking at co-housing in Canada, and it's not a very popular approach yet, except on the West Coast. And it's that multiple lens for which we have to look at aging in place, and it's what's needed. Um, but someone has to be looking at it. Someone has to be coordinating it and helping people navigate this complex system. But it's more than navigating, it's accompanying them, and it's being there to be able to reassure and empower. And it's very complex. I mean, if the question we were discussing today were easy, we wouldn't be here, right?
Well, I think building on that too, Suzanne, it's been fun reading in the chat, as folks are just knowing how everything's so highly fragmented. I mean, I think we have all the right elements, available in Canada. How well they're funded, that's a whole other issue. I don't think things are as well funded as we've seen in other countries, for example, like Denmark, where up to 40% of their healthcare spending is on, community-based, kind of long-term care and other services, for example, that can support people, to age at home and have, a real neighborhood and network feel to how services are. Because I think the thing that I notice is how many people I encounter as patients and their families who just don't even know where to start. They have that deer in the headlights look, like you've just given a diagnosis, for example, of dementia. And you're grieving at the same time, going, well, this is going to be progressive, this is going to get worse, and I don't even know what the prognosis is going to be. And then on top of that, where do you get support, and where do you even start? And so it's a challenge because we don't really have a system that makes it clear to people that if you need help, just call this number and we will help get you oriented and organized. I find often there's a lot of care coordination being funded, but it's only funded to coordinate the services that group is providing, as opposed to kind of more broad things that can actually help you know that, yes, I can coordinate your home care, but I can also link you to these community support services and I find often that's what I'm supposed to do. I'm a very expensive resource to be able to do something that should be relatively straightforward. So how do we create kind of a really well-organized, community-led resource so people in a neighborhood just know, well, I think I might need some help. I'm going to call X, and then they can say, yeah, we are, like we can help you from here, figure out what you need, what's right for you, what matters most, and then how do we figure that out? Because every situation is different. So I think that's kind of how we get there. That's going to be the interesting question, but we need to get there. We need to.
I feel like we've been able to create some of that, Samir, with the program that we have with Nursing Home Without Walls. It's bringing the proper resources in, a bit, dep not dependent on if they're formal or informal service or whatnot. It's okay, what does the person need? And it's coordinated, right? And I think that's why it's working, and it's flexible. So it's not just about here's the list of what we can provide. It's actually the opposite. It's asking the person, what do you need? And doing our best to meet those needs, right? And so again, it's a change of the way that we've been doing things. Yeah.
I would add two things, and just picking up what you said, Samir. Number one, that whole linking, the healthcare system to the community and the work of social prescribing and link workers to help with some of that navigation. So I would say that's kind of an interesting movement that's gaining speed here in Canada. The other piece is when we think about the community hub type model. So it's like that one-stop shop. There are certain hubs that exist across the country, and they're offered by different groups. So it could be part of a library or a community center, or maybe it's your community health center. But what are those essential ingredients to create this 360 ecosystem? And there is a blueprint that was created by SE Health and Covenant in Alberta called the 360 Living Model Blueprint. And it provides some guidance in terms of, what are those 5 or 6 essential elements that you want to have in your community hub that's tailored to your community, but it could potentially service as 360 ecosystem. So going to one place for your health needs, for any housing supports, other community supports that you might need. So I would say definitely check out that blueprint, and it's on the Courage Action for Better Aging website.
Thank you, Zannat. And we'll be sure to connect folks with those resources with our mail out following the webinar. It's interesting. It's occurring to me that so much of what we're advocating for and what we're aware of in terms of what's needed in some ways is trying to replicate a lot of what you described, Bella, that your parents had, in their way of living within community, and that intergenerational living that was sort of inherent to the culture, and the ways in which we would take care of friends and neighbors and family members, but recognizing that there still is a component of needing to connect into formal services and health services as needed. And it just feels like we're trying to shift back to what some cultures have had so inherently and beautifully for so long. And I noted, it was shared with me recently that there was an article, and I will pop it in the chat, that was published just a couple of days ago. And the title of the article is "Social Isolation Sends More Adults to the Emergency Room." And I know that, a lot of the work that you folks on the call are doing, really is about bringing people in connection as a way of promoting health. And so, wanted to just leave some space before we transition just to talk about social isolation and loneliness and the importance of how we help to navigate that in addition to some of the more formal health services. I don't know if folks wanted to make any comments in that direction.
I think I can say that is one of the number one issues that people face in our communities, because the type of living or setting of the environment in the home is very different now. Even if you live with family, they're not there most of the day because they're out working. Children are not in the home because they're at the daycare or at school, which is completely different from what it was. So even if you live with a family, you can't wait for them to come home. When somebody comes to the door and comes in, the children come home from school, like, you are so happy to know that, the house is going to be full again. But then those hours from the time that everybody leaves in the morning, those are long hours. You are alone unless you have some kind of formal support. And formal support is not always easy to come. Sometimes I find that you have to have had an accident in order to be able to get on to the right door to get the service that you need. People don't willingly go and say, hey, I'm of this age, I'm alone. Yes, I live with family, but I'm alone most of the day. By the time family leaves, I want to be able to take care of my own hygiene, but I'm alone. I don't want to take a shower when there's nobody else around in case I fall. What if, there's so many what ifs in the home now that is so different. So that's the situation now that we are in, is that, yes, we had that kind of that support that we needed within the family. I can't say community support because we lived in family units away from everybody else. We didn't live in the community, so we didn't have community support. when I started coming in to work as a young social worker, one of the things that I did in the to help elders who could not go on the land anymore and be with their families, and they ended up being left behind in the community with no help. I set up group homes for them, and that's where they went. But only 10 months of the year, when the family was back from the land, they returned to the family, and the homes were closed so they can spend the time with their families. And that happened for a number of years. And then we got to be better. That's what we thought. And then we set up these elders' homes. We have one elders home in our community in Mistissini with a population of about 5,000 people. And that's been in operation for 20 years now. And, that's gone from the group home to that. Now we are in the process of setting up a long-term care center in the community. But that hasn't happened yet, and I don't foresee that happening in the next couple of years, okay? And I know some of you talked about the fragmented formal supports that are out there. And what is needed is, for somebody to come in and pull all those together and coordinate all these services. And that is exactly what is needed in indigenous communities. Mistissini is good because we're bigger, so we have more access to that, but not enough. And not enough because we have right now, my generation is not how do I say it? We are not many, but anybody that was born after the 70s with vaccination, better health services, and running water and everything else, and there was less babies dying. So what happened? We doubled the population, and those are now in the 40s and 50s. So in a few years from now, half of the population is going to need those services. And this is why I feel that we have to come together and we have to look at what we have and what can we do to, like someone said, I don't know who mentioned it, is having, it's the coordination of all of this. I can truly say that we do have in Mistissini, I cannot speak for smaller communities who don't have it. We have the infrastructure to be able to do these things, but it's a matter of making it a priority. And I don't think it's going to be those who are in their 40s and 50s now who are in leadership positions who are going to do that. It's actually people like me who need to come forward and say, hey, let's start talking about it, because what we're going to be talking now today is going to be something that you're going to need yourself soon. And the service will not be there to meet all of your needs because there's many of you. So it's a reawakening. So that needs to happen. So I hope I get to live long enough to be able to be that voice.
I hope so. Come on in.
Sorry, I just want to pick up on something that's in the chat, talking about fragmentation and not knowing what's out there. And I just want to, I guess, put a plug in for HelpAge Canada, if I can shamelessly do so, because one of our big pieces of work is coordinating a unified CBSS sector, so connecting community-based organizations across the country. Because sometimes there are, fantastic initiatives happening in one place and others don't know about it. And we're working towards a systems map. So you can see in your neighborhood, in your, city, province, et cetera, like what actually exists, but that's more on the community-based side. And this sector building work is being guided by a leadership council with representatives from most provinces and territories. So I think by bringing people together so that people see, what are there other services in my area that people organizations can then reach out to others to say, hey, you're providing this service. Well, we don't have that. And how might we connect? So I do think, and it might have been you, Suzanne, talking about the strengths of the community and mapping those strengths, because things do exist and we're not starting from scratch. So how do we build on that? And I think, Andrea, you had a great conversation with, I believe it was Cormac Russell, talking about using the ABCD asset-based community development approach. So I just wanted to say that, yes, we all kind of need to pull together and trying to bust these silos and prevent further fragmentation.
Yeah, and just to build on Bella's points as well. And to your question, Andrea, about just social isolation and loneliness, right? Is that these are, I mean, severe loneliness and is seen as the equivalent of smoking up to 15 cigarettes a day. So this is a real health concern. And as Bella was mentioning, people say, well, I want to age at home, but I sometimes have to talk to people about saying, that is this the right environment for you? Because you're on your own, you're not able to get out, you don't want to get out, and to a certain extent. And so you're almost trapped here, on your own without that social interaction that's so vital and crucial. So it's trying to say that if you want to stay in your own home, between those, those 9 to 5 hours, as Bella was saying, where everyone's out of the house, either working or going to school or doing whatever, how do we make sure that that person can connect with other ways to stay engaged with other members of the community through connections to adult day programs, other things that one can go out and do, with the support of community transportation, or even, there's Senior Center Without Walls is a really good program that you can actually do the telephone chats and interact with other people. But where that isn't an opportunity, what are the other environments where people might be able to find social interactions in that? Because it's so important for our health and well-being, and also for preventing or delaying dementia as well. So there are real significant aspects that we have to think about as we knit all this together, and really think about what is that right formula to help people, age with dignity and age in the right place.
Thanks for bringing that data into the conversation around social isolation. We're getting to the almost to the top of the hour, and this has gone by so quickly. And the intention for this conversation was to acknowledge, where we are, but to really see the possibility in what we can step into to support aging in place. And Bella, I liked your framing of it in that we need to start by talking. Like we need to be shouting from the rooftops what these needs are, because it's going to take us a long time to build the systems to put that infrastructure and supports in place. And I think this conversation is along that intention of sharing what's needed. And what really came out is that we have so many pieces, right? We have assets, and taking an asset-based community development approach to lifting up and connecting the gifts that we have is going to give us a lot of value. And that what people really need is that coordination in that person-centered way. It's coming back to you, Samir, of what matters to that person. How are they going to actually live their life? Will they leave their house in the hours of 9 to 5? No, then what are the opportunities? What are the options that best suit that person? And how do we not just hand over a piece of paper or a phone number or a referral system, but how do we accompany them and create the support systems to accompany people to those supports, to connect them in good ways? And so for me, that feels very hopeful. Right? We have such rich resources, community, social, health, and really what it's time to do is tighten those up and mobilize funding in ways that allow those pieces to connect, and that value to really come into play for individuals in the way that matters to them. So I'm feeling that sense of hope, and I'm seeing that possibility, even more so than I did, I think, coming into this conversation. So I want to thank you, each of you, truly and deeply, for being willing to engage in this discussion, for bringing yourselves, your personal experiences, your stories, in such a rich way, and for inviting each other's thoughts and ideas into the conversation. I hope that everybody who joined today heard something, got something, um, felt something. And so before we just formally end, I also want to share a new Healthcare Excellence Canada resource with you. It's called the 7 Elements for the Successful Engagement in the Care of Older Adults. We'll put a link to that resource in the chat and also share it out in our post-webinar communication. And this resource offers strategies for inclusive engagement, leveraging community strengths to shape solutions that reflect older adults' needs and experiences and support long-term impact. So again, thank you so much. We're going to put a little poll on the screen now. If you don't mind taking 30 seconds and just letting us know about your experience today, this helps us to plan for future webinars. And finally, thank you all to our whole community, to everybody who joined us, who's listening, who's listened in the past, who might be hearing this recording. You have really moved us over the past 2 years to seek out new thought leaders, new ideas, and things that will help to advance us in our ability to help older adults age in place. So thanks for being such a strong community and for bringing us together with purpose and intention. I'm wishing you all wellness, and please continue to reach out to Healthcare Excellence Canada as you continue along your journeys to support aging in place. Thank you, speakers. Thank you, everyone. Have a great, great day.